We are now well into our COVID response as a nation and as a county. It's been very challenging for us. I've had many opportunities throughout my career to be responsible for emergency operations at the county. And actually I am designated as the county's emergency manager for the County of Orange, or part of Region 1, which includes Orange and Los Angeles counties, and then we have Cal OES, and then the nation behind that. And this has been very challenging because of the demands being placed upon our system. Normally, if we have an emergency like an earthquake where we work with fire, we can go to our local resources and augment. We can request resources from outside of our region to Los Angeles and beyond, and usually those resources are quick in coming. This is different. We're all competing for, quite honestly, the same resources, at least in the infancy of COVID. We all needed masks, we all needed gowns, we needed all these resources, and we're competing in the region, in the state, the nation, and the world for these resources. I'm happy to report that we have an ample supply of resources within Orange County at this time, but that's because we were able to flatten the curve, so to speak, and spread those cases out over a longer period of time, and took that demand off of the system, or at least spread it out over a longer period. We got out ahead of this from a law enforcement perspective early on. We changed some of our protocols. I'm part of the Orange County Chiefs of Police and Sheriffs Association. We shared what we were doing in the Sheriff's Department. A lot of the municipal agencies followed suit with platoon scheduling, locking down, eliminating visiting or unnecessary functions within the Sheriff's Department. We closed our counters up. Through our dispatch, we told people to expect a change in our delivery of services so we could stop unnecessary contacts or prevent those however we could. And I think all those things contributed to, at least internally, a stopgap that put us in a really good position. Platoon scheduling, for example, was necessary because we went to strict platoon. You can only work with the people you're working with. And because of that, we had people in reserve. So if we had an exposure in a work environment, we could take that entire shift out, obviously do all the sterilization that's necessary, and put a fresh team in without any cross-contamination from unit to unit. And that was, I think, one of the critical things that we did early on. Unfortunately, in our jails, we had a control effort, and we did have a case that broke out in about mid-March. And up to that point, we didn't have to release anybody early. And we have not released anybody early from Orange County Jail for more than a decade. It's been a long time since I can remember that. We actually have capacity within our jail of vacant beds, and allowed us to move people around and create those distancing as necessary. Once we had the breakout, though, it became necessary for us to create more capacity. And the government code allows me broad authority to release inmates entrusted to my care. In fact, I have the authority to release anybody from jail under emergency conditions. Of course, I was not going to do that. I worked with the courts and identified what I believe was the best option available, which was already sentenced inmates who were for low-level offenses that had no violent criminal backgrounds. And what we in essence did was just release them from custody a little bit early. And to date, we've been able to release about 500 and so low-level offenders early. We did that up to 30 days early. And then for those who were identified by CDC guidelines as being an at-risk population, either by age or medical conditions, pre-existing medical conditions, we went to 60 days early for those individuals. So we were able to take our jail capacity actually down almost 50%, which was a huge effort for us. And that's in addition to the court's releases. Some of the court releases I didn't agree with. Those were done through zero bail, and we dealt with the Judicial Council on that. But we have, I think, effectively addressed this issue. If I told you the numbers, it would sound staggering. We have to date had 385 positive cases within Orange County Jail. We currently have 23. This is the important part. We've mitigated the majority of those to have 23. And what we do is we have, and I'm sure that the folks at the hospital can share this in his presentation as well. We have medical isolation. Those who are exhibiting the symptomology, flu-like symptoms, we isolate medically, and then we quarantine those who had contact with people entrusted to our care in the jail. And the way I can do that is every inmate in the jail has an RFID card. Every time they leave or move about the jail, they have to scan out and scan in somewhere else. And for those reasons, we know who everybody is, where they've been, who they've been in contact with, and then we can isolate for medical purposes, or quarantine rather for medical purposes those, and wait 14 days. At the end of 14 days, everybody in quarantine gets a test. And this is where those numbers are really important, because Our numbers may appear to be staggeringly higher than others. I think the difference is, like we're seeing in the community, we're testing more people. We're testing more of our inmates in our care. In fact, we've tested all of the employees, both with healthcare and within the sheriff's department, who work in our jails. And for that reason, I think we have a better understanding of what the risk is that we're facing with our jail population. We still currently have 495 people quarantined. And that sounds like a lot, but they have two types of quarantine. We have those who are exposed to somebody who had COVID, and then we have new booking quarantine. Those are people brought to us from a new booking from an agency, and everybody brought in the jail gets quarantined for 14 days, so we don't have somebody coming in and then infecting the rest of the jail population. And of those 495, 459 of those are new booking quarantines. I think what was surprising to us, and I think what we're learning now about COVID-19 that we learned early on, was when we had our medical quarantine, those exposed, and we tested every one of them, about 80% of those that were tested came back positive or asymptomatic, had no symptomology of COVID. And we're learning a lot about what this is. The whole presumption early on that you had to have these symptoms. In order to get tested, you had to have a cough and a flu-like symptoms and fever. We're learning the vast majority of those that we're testing within our facility aren't exhibiting any symptomology at all. We've had 10 employees that have tested positive throughout the department. They've all fully recovered, I'm happy to say, and I think some of the measures we put in place have attributed to that. I know I only have a couple of minutes. I'm looking at my notes to see what I would like to cover next. I think we're on a good path. I'll cover a little bit about the continuity of commerce. When you get into these, how do we get things back up and running? Continuity of commerce to me is very, very critical and important. And I will agree with the healthcare professionals that masks are necessary. Social distancing does have a contribution positively. Of course, hygiene, washing, and all those things you can do are critically necessary. But I think if you look at the data, at least from several weeks ago, and I am concerned about some of the things I've seen about the mass gatherings and protests where people in close proximity may have an unfortunate consequence as we move forward. But what we saw comparatively was Orange County was really much flatter in its curve than some of our surrounding counties. And I think that shows to how our residents in Orange County were being responsible. We're following the recommendations. And my ask would be, absolutely, we need to open back up. I think people are getting tired of being home, and we're probably going to get to be much more restless, if you will. We're starting to see protests earlier on around COVID-19 about closing the beaches and other things. So mine is not taking a position in support of the protests. I always will support the First Amendment rights of protesters. That's one of my fundamental functions as the county sheriff. But to do that responsibly so we don't, in essence, ruin a bad thing. We got a good thing going. We should do everything we can do to make sure that we keep the right trajectory, if you will, and keep that line as flat as we can as we move forward. And I'm looking at the clock. I think I've been about 8 or 9 minutes, but I talk fast. I may be longer than that. And I'll open up to questions that you may have of me, specific to COVID-19 or any other issue that you'd like to bring up.
Thank you, Sheriff. I have a few questions that were sent in prior to the meeting I would like to ask, and then we can take some from the audience here with us today. Actually, a few people had emailed in with similar questions, so I'm going to try and phrase it so it answers all of them. But it appears as though the reopening phases that first seemed to be organized and made sense have become convoluted, and things are opening up oddly staged. And so is there a place where the members can go to see what is allowed open, what isn't allowed open, what the trajectory looks like of when it may be open? And then in regards to that, there have been a lot of restrictions put on businesses to reopen and rules that they need to follow. Is there people out there checking those things? Like, is it the health department, the sheriff's department? Who is enforcing that, or is it kind of a self-certification thing?
Those are both great questions. So first, I would direct you to the conditions and who is allowed to open based on the state guidelines to the county's website. It's in there. I've had problems with this from the beginning, to be quite honest with you. So much of this has been subjective and open to misinterpretation that I don't think it really steered our citizenry through this in a way that they could fully grasp it. I'm going to give you an example of that. If you look at the state's health order, referred to a document called the CISO document. It's actually a Homeland Security document about critical infrastructure sectors, and it defines those that they are. And if you look at that first health order, and it went to the CISO document that existed, and it said, you know, I'm not picking on anybody, it's just my concerns. So go look at this document. It's very clear and tells you what can be operated and what can't. Well, that's a continuity of commerce document that was really framed after 9/11. If you looked in that document, it says things like sports venues and amusement parks. And well, we know that doesn't fit. So from the very beginning, there was a miss and conflicting information that existed as we navigated that. And to make it even more convoluted, that document and all versions of it, the second paragraph is very clear. It says, these are recommendations. They're not all inclusive. And so it leaves it to be very, very subjective. And I don't think you can navigate through this with so much subjectivity. So I would go back to, and the other thing that makes it complicated for us in Orange County and the other 57 counties is the state of California, the governor's order, and the health orders coming from Sacramento govern what we cannot do. So outside that initial order, there's really only 5 prohibitions that existed from the initial order. It was in-restaurant dining, bars, gyms, and whatever else was in that initial order. So then it becomes very, very subjective. And that's not a good way to manage an incident through subjectivity or different views on how those can be interpreted. So we're being governed still by the state on what can and cannot open. I'm not saying that I agree or disagree. That's just the way that we're navigating through this emergency. So we're in a 3rd iteration. We're now getting to phase 3. My wife, probably like many of the ladies I can't wait for the nail salons to be open. That's the one thing she's waiting for more than anything else. I'm not sure that is a bad thing that they're, you know, I don't know if it's good or bad. I think that they probably can be responsible as anybody else. Ultimately, through all this, we are responsible for our own health. If you're in an environment where you don't think it should be operating or not looking out for your best interests, then I would say use your own best judgment. If you don't want to go into a restaurant that you don't think is meeting your level of health or looking out for your best interests, don't eat there. There's always options. These aren't mandatory to go back and re-enter back into the commerce. And as far as enforcement goes, this is, you know, you may have heard my comment I made at the Board of Supervisors, asked, you know, if I was going to enforce. And I said, no, I'm not. I'm not the mask police. We have a law enforcement function. I only have so many deputies or so many things, and crime is still occurring. We still have to go and handle our business. What I don't have the resources to go out to every situation somebody says somebody's not wearing a mask or they're 5.5 feet, you know, apart, not 6. And are they family members or not? I mean, it's just not something that is really, in my opinion, feasible to go do. Do I believe masks are critically important? I do. I do believe masks are important, but I believe that we have to have people buy into their own contribution to the safety of themselves and others when they go out in public. Regarding the businesses specifically in your chamber, I would say I would err on the side of good judgment and do what is necessary to protect yourselves and your patrons. And I think those establishments, quite honestly, are attracting people in more when they know that you're looking out for their best interests and those of your employees to make sure that you're doing everything you can to make a positive contribution to stop the spread of COVID-19. Those businesses that are absolutely defiant, I'm not sure that that's a responsible approach. And I'm not sure that people going there understand the inherent risk of being that brazen and oppositional to some of the, I think, legitimate health orders and concerns that we should all have.
Along those same lines, some of our businesses are concerned about the possibility of an ADA type lawsuit. If they make it mandatory for their patrons to wear masks, which they want to do to protect their employees and other patrons. Yet even in the health order, it says something to the effect of if you have a health or mental condition, that it is okay. Well, you can't really ask somebody, hey, what's wrong with you? Why are you not wearing a mask? Do you have any insight or I guess?
That is probably an issue that's way beyond my pay grade. You're talking about risk mitigation, litigation, ADA compliance. I hate to say it, but there are attorneys that exist solely to sue people on non-ADA compliant issues. I would use your best judgment. I think the best way to work through that is to find sound policy that can be shared through the Chamber of Commerce, and say, these are our recommendations how to navigate that. Get some, you can either do it jointly. Obviously, there's an economy of scale to getting one opinion that will probably you can share within the chamber on how to address and mitigate that level of risk through good sound policy. It goes back to, we did with the same thing years ago with recreational and then medical marijuana. I recommended to people, you have to have a sound human resources policy in how you're going to deal with employees on the use of marijuana. And it's defensible when you do that. So I would use the same approach and the same measure to get a good opinion on how to navigate that, what you can ask, what you can't ask, what policy you can put in place. And keep in mind that health orders have some very specific things that you can do during this that transfers onto you, that gives you the ability to protect your establishment and the people there. You're a private enterprise. There are ADA issues that you have to comply with, but you also are a private business, private property, I'm assuming for most of you, are not publicly or a government entity. And that allows you some discretion to say you're not going to serve somebody as long as you can defend it. And it's based on a reasonable expectation of keeping your establishment safe. And at the same time, complying with the health order, right? Because you want to make sure that you maintain compliance with the health order above all else. So also you may have that. And your other question that you asked, are we enforcing this? No, we're not. We're not going around and looking at people. We're trying not even to respond to these calls. We're letting people handle it. There are licensing that goes along with some of these things. If you have business licensing, for example, in Fountain Valley, that might have a provision. If you're part of, if you're inspected through the county, through either the health department or some other oversight mechanism, you'll have some compliance issues that you want to maintain as well. So it's a lot of things. It's not easy, but there are a lot of moving parts that you want to make sure that you're compliant with to mitigate the risk down as best as you can.
Thank you. Okay, I have just one question, and I'm not even going to very specifically ask it. It's regarding the recent riots or protests. What did you see on the ground there? Did you see evidence of domestic terrorist groups behind it? Did you see pretty peaceful organizations? And how was that handled? Were there many arrests? Just kind of an overview of what you saw.
Sure. So first, let me just qualify what I saw in Minneapolis, which was absolutely criminal. I may have been one of the first law enforcement professionals to speak out publicly about what I witnessed in Minneapolis. We do not, in fact, that's the first time I've ever seen a technique, if you want to call that a technique, used in law enforcement. And it's not a technique, it's simply murdering somebody with your shin over the course of 8 minutes. It is absolutely, I would condemn that. If it was one of my deputies, I would grab him and walk him to the jail myself and file the charges. That was absolutely criminal. But we don't do that in Orange County. We don't train that way at all. We use different techniques. We focus on de-escalation. We have a very robust use of force policy and review that we have in place. In fact, this is how we handle use of force in the Orange County Sheriff's Department. For those of you that don't know, I know most of you have municipal police departments. We patrol 1/4 of Orange County. About 800,000 residents of the 3.2 million receive their law enforcement services through the Orange County Sheriff's Department. In 2019, we had over 350,000 contacts with the public. And of those, we had about 421 uses of force. And the use of force by our definition, there's no universal definition of force within law enforcement. It's subject to the agency. Our use of force definition is any force beyond handcuffing an individual. So if we had to take them and move them, put them on the back of a car, use a control technique, that is a use of force within the Sheriff's Department. That ratio is 12 per 10,000 contacts. It is very, very low. Most of those are within our policy, and those that aren't within policy we deal with. And most of the policy violations are things other than the force, like inappropriate language used, or maybe not turning on your camera in your car or something like that. So there are other things. I think we have a very, very robust use of force, and I think a model use of force policy. So much so that California Department of Justice several years ago asked us for a policy that they could emulate as a model. So I'm very proud of what we do here within the Sheriff's Department. The other thing I just want to cover real quick, I know I'm going to answer your question in a second, just give me 1 second, because this is important. I've been doing this many times with some of the special groups and advocates for Black Lives Matter and other groups. And one of the questions that comes up every time is, why is there no accountability? There's no accountability in law enforcement. That is not true. Of the incidents that happened last year, we had 126 internal affairs investigations that we conducted last year, involving almost 200 individuals. And of those, 138 were found were 60 were not sustained, 138 sustained. But this is an important part about accountability. Of those cases, the 126 investigations, 84% of them were initiated by my department observing conduct that was not following policy. Not the public bringing it to our attention, internally identifying these things and acting upon it. Put a different way, 17 out of 20 we found, and 3 out of 20 were brought to us from outside the organization that we acted upon. So regarding the protests specifically, what I saw in Orange County for the most part were very peaceful protests. We actually deployed thousands of deputy sheriffs in support of the more than 35 protests that occurred to date in Orange County, and we still have some scheduled coming up. What concerns me most about this very necessary movement and dialogue that needs to take place between police community relations are the bad actors that showed up at some of these events. They really hijacked them for criminal purposes, either looting or vandalizing or whatever happened through that. That is really detracting from the necessary message that we need to have reconciliation and healing within our communities. And I'm proud that we were able to do that very successfully here in Orange County. You probably read, I did have a deputy had a patch on in one of these. That was addressed. That's outside of our policy, and we're looking into that as well. But he does not represent our organization. Just like the 4 officers in Minneapolis doesn't represent national law enforcement. It's an isolated incident that unfortunately we all get painted into that box with a broad brush, that this is a systemic issue with all law enforcement. And I would actually say, I don't believe that's the case. I think that exists throughout the nation, but I think we need to deal with it as a nation because we have to move forward. But I would stress that the actions of those 4 individuals and others that have occurred throughout the nation is not representative, at least in my opinion, Southern California law enforcement in Orange County, and most definitely not the Sheriff's Department that I'm privileged to lead.
Very good. Thank you. Those are great answers. We have just a couple minutes. If anybody has a question that they would like to ask our sheriff, either use the hand raise function or just go like this, and I will scroll through and see and unmute you, or try. Okay, great. There you go. Go ahead.
Sheriff Barnes, I'm a licensed individual practicing in the county. I go to a lot of your seminars. I cannot and will not stand for anybody saying that they want to defund the Orange County Sheriff Department politically. Do you have any events that we can very specifically go to after COVID lifts that would support directly the Sheriff's Department that's not like an athletic event or something like that?
We do. I think that probably the first, the Board of Supervisors, they control my budget, or at least approve the budget. And there's been some misinformation about for several years about me being over budget. That is not true. I know that everybody here is involved in business, and probably many business owners. What's happened over the course of the last 5 or 6 years is the county has deliberately underfunded the Sheriff's Department. It started several years ago where it was $8 million underfunded, 15, 23, 37. And it's all part of a budget strategy that the county budget office manages. And the way, and I'm not trying to be critical of them, it's just something I didn't agree with, but that's their practice. They would underfund the Sheriff's Department, knowing that in the third quarter of the fiscal year, all the other county agencies would underspend what's allocated to them. They'd aggregate that money back and then move it back to the sheriff's budget to make us whole. And that's just a budget strategy that the county, I don't like it because I told them years ago, eventually somebody's going to think that we are not managing our budget well. And that's not true. So I think first that is important. So the County Board of Supervisors manages our budget. More importantly, some of the messages that are being said about, I won't say defund the police, but fund other programs, I'm all in. I'm on the President's Commission for Law Enforcement and Administration of Justice. I'm on a committee for social issues. Those include homelessness, substance use disorder, and mental illness. And if you saw my testimony, it was very clear. There's a gap that's created by services that do not exist outside of law enforcement. If somebody's mentally ill or substance use or drug addicted or homeless, we should not be the first face of government that they encounter. We should be the absolute last. And what's challenging to me is, in my budget, I don't get to pick who comes to jail. They come to me from other reasons, from the courts or agencies who arrest them for law violations. And I have a responsibility to treat them while they're here. I run the largest mental health hospital in Orange County. 40% of my inmates entrusted my care have a daily nexus to mental health treatment. 1 in 5 are self-declared as homeless. 50% have a substance use disorder or nexus to narcotics, and all the co-occurring issues that happen with that. And you complicate that with the fact that these are, many of them hardened criminals, and you have to put them in the system and make it all work. So I've advocated for programs that should be in place to appropriately treat or divert people away from jail before they come here. Or if they do come here, I have very robust programs within the jail. For example, I have 100 to 120 people every single day who are detoxing off of alcohol under drugs. So we are now implementing a step-down unit, medically supervised with MAT, medically assisted treatment, to get people into sobriety, and working with the public post-custody to get them into sustainable services. So people we get into mental health stability, to keep them, put them in an environment where they can maintain that stability, or people who attain sobriety, to get them into programs that keep them into sobriety and are very supportive of that. All the homelessness, I'm on several different I'm on the county's Orange County Commission on Homelessness. I'm on United to End Homelessness, and I'm on the county's Housing Finance Trust that's aimed at building out our homeless, our inventory of housing. All those things need to be put in place. And if we can get those things put in place with some investment that will reduce the demand on the jail, then we can start to reduce the costs of the Sheriff's Department budget responsibly. But we can't just stop all these things and then hope that these other things will be put in place. There has to be a timeline to do that responsibly. And I'm all in for that. If I could reduce my jail population by half, I'm in. That's a good thing for all of us if we can do that responsibly. We have to get people into these other service provisions to do it the right way. But I'm with you. My budget's very, very lean. I'm already going to be impacted just like you are in commerce. My revenue is based on taxes, either sales tax, property tax. It's a tax stream that comes to me. My budget next year is anticipated to be $161 million short. My net county cost, net county cost is the general fund expenditure that the county puts into my budget, is only $180 million. So the county's telling me I'm $161 million out of 180 that they provide. That is going to decimate the services. And we provide countywide services to all residents. You don't have to be a contract service provider with the Sheriff's Department of Fountain Valley or anywhere else to get the benefit of the services we provide. We have numerous countywide services that if we have to scale back, will impact every resident in Orange County, not just those who are serviced by the Sheriff's Department. And that's very, very concerning to me that we have these potential costs. And I'm sorry, I'm going to go on just a minute longer to make this even more complicated. We have legislation that's being passed that are really unfunded mandates that are putting additional burdens upon my staff that I have to be responsive to without the personnel or the cost to cover the personnel to be responsive in those efforts. So it's really, I hate to use the term perfect storm, but we have to be at least responsible in how we evaluate how we're going to move forward and what we're going to fund and where we're going to put those very important and critical taxpayer dollars. But I'm in for that, but just, I don't think you start with the anticipated end result before you have all the infrastructure in place to do it responsibly. I know that my folks, I can see Ken from Fountain Valley Hospital can talk to the issues of being the default mental health provider for people who are in mental health crisis when our medical facilities are designed for people for medical trauma. and they routinely end up in our ERs, which is not the place they should be going. And of course, I guarantee they're seeing firsthand the opioid crisis that is happening throughout our nation that they're having to deal with as people come in routinely overdosing on fentanyl and other drugs.
Very sad. Thank you so much, Sheriff, for your time with us today. We appreciate you and the service that you provide to all of us and the way that you advocate for us on our behalf. So we thank you very much. And we're gonna move forward now. I have a short video from our sponsor that I would like to share.
Thank you. Thank you.
Thank you.
Thank you.
Thank you.
Gracias.
Thank you, SoCalGas, for sponsoring this event today. We're going to move on now and get an update from our local Fountain Valley Regional Hospital. With us today, we have the CEO, Mr. Kenn McFarland, and his Chief of Staff, Dr. Hoang Lee. Let me unmute you guys. Hold on. And no. Okay, there we go. Okay, you're unmuted. Thank you.
Good morning. Good morning, Memory. It's a pleasure to be here. And you know, before jumping into our topic, I want to acknowledge and thank our sheriff and his entire department. We're blessed to have so many first responders in our midst, not only at the county level, but the various cities and municipalities that are standing tall. There's a lot of tension going on out there, but we here at Fountain Valley Regional Hospital greatly appreciate those keeping us safe and protected, and we look forward to supporting them as well in the future. So thank you for allowing us to share the stage with Sheriff Barnes, excuse me. But I also want to say thank you to our sponsor, SoCalGas. It's a pleasure. They've been great supporters of the hospital as well, and great supporters of our community. So let us tell our story a little bit. And I know there's a lot of questions, Memory, and we really want to spend as much time as possible covering those questions. And but I thought it'd be nice to set the stage a little bit and get some context for the discussion. So we knew something was coming down the pipe in the early part of this year in 2020. We were having a strong flu, not one of our bigger flus, but not a weak flu in the holidays of going November, December, coming into January. And as January came around and we started getting the intel from what was happening overseas, we were being sensitive to what might be, lurching around the corner. So it wasn't until the early part of February that we first started getting some patients here at Fountain Valley that were presenting themselves as potential COVID infected individuals. And so, we initially took that as an opportunity to really circle the wagons, if you will, and bring our leadership together to really talk about and prepare for what could be a very serious matter. And just for those who don't know that are listening or watching on this program, we've been in the community of Fountain Valley since 1971. We're a 400-bed hospital, And, you know, on any given day, we have about 200 emergency room visits. On any given day, we're doing between 35 and 45 surgeries. We deliver anywhere between 8 and 10 babies a day. We're a very vibrant, busy place, and we deal with stuff all the time. We deliver great medical care. We have brilliant physicians, committed nurses who are just professional and always doing what is necessary with the community's heart and mind. So we, in preparation for what might be lurching around the corner, well before the governor issued his state of the state in terms of the emergency, we started looking at our own campus dynamics and looking at what can we do to make sure we gain control over this very serious matter. So I'm calling it a serious matter before it became a pandemic, and I really want to emphasize that. So we're a big 35-acre campus. We have 2 hospitals on this campus. One portion of our campus has 300 beds. One portion of our campus has 100 beds, making up the 400 beds. So immediately we just started limiting how people come in and out of our 2 hospitals on this campus. So we narrowed entrances from about a dozen to 2 per structure. So a dozen entrances down to a total of 4. Well before folks were asking for this kind of management of the facilities. So this is mid-February going into early March. And around March 12th is when we started sensing something very bad was certain, and we wanted to make sure we got out in front of it. So March 12th, going into Friday the 13th of all days, is when we took matters to what we'd call a very high level of control in terms of our facilities. That's when we, for those 4 entrances, we started taking temperatures. For those 4 entrances, we started limiting visitor access. For those 4 entrances, we stopped letting third-party individuals come on in. And so what we are doing is really managing the ship, really managing who's coming in and out, taking temperatures, checking for signs of an illness, flu, COVID, or otherwise, and making sure that we were controlling this campus. We also made sure we had adequate and substantial PPE, that's that personal protective equipment that everybody's talking about. And we wanted to make sure we had done proper and thoughtful education throughout the campus with our 2,200 employees, our 800 physicians that come in and out of this facility each and every day. So, you know, that big day, Friday the 13th, the world changed. That evening, the president, along with our governor, issued the state of emergency. So coming into the week of March 16th, everybody was getting in line in terms of how they were going to manage their medical facilities. You've heard a lot of language around electives. There was, in the state of emergency, a mandate to stop performing elective procedures. Our mantra here has always been, if you need medical care, we are going to take care of you. So there's a lot of confusion, and we'll dispel some of that confusion as we answer some of the questions that were presented to us. But from that day forward, as we locked this facility down, we did all the proper training on PPE. We made sure people coming in and out had all the proper screening. You saw some radical changes happening in our community. As an example, when I talked about 200 emergency room visits per day on any given day, and 35 to 45 surgeries, delivering 8 to 10 babies a day, those numbers came down dramatically. We were seeing about 60 to 75 patients a day in the ER. We were doing about 10 to 12 surgical procedures a day, and our believe it or not, the deliveries actually came down, because there's a lot of medical tourism that was taking place in here at Fountain Valley Regional, along with a lot of other hospitals in the community. So not only were we just hunkering down for the event, for the pandemic, because it has now attained that title, we were seeing people not only deferring elective care, but deferring necessary medical care. We were getting reports of individuals suffering potential strokes, heart attacks, and other episodes. And out of fear, given the way this thing was presenting itself, staying at home, quarantining, and unfortunately, potentially having some poor outcomes. So we're thankful that this thing has matured to the place in which it has. And we are open to all our communities, all the surrounding zip codes. There's about 33 zip codes that hug this hospital. And we just want to make sure everybody in this community knows if they need emergency medical care, we're here. If they need medical attention, we're here. If they're having chest pains, we're here. If they're having signs of stroke, we're here. If mom wants to deliver, we're here. And I'm thankful that since the return to normalcy is starting to take shape, we're seeing more and more folks in the emergency room. Those numbers are hovering around 100 plus each and every day for daily visits to the emergency room. We're doing around 30 to 35 surgical procedures a day. Our physicians and our community members are thankful the doors are open. Delivering 5, 6, 7, 8 babies a day. We're thankful that, I'm sure nobody wants to be, labeled a COVID baby, but there's babies calling, their first days on this planet, they're being born during a pandemic. So we're thankful that, the community's recognizing the doors are open. The community is recognizing that this is a very, very safe place to get care. I think the community is recognizing with the visitation limitations, the temperature that are being taken at the entrances, all the PPE that we're requiring. And if you don't have a mask when you come here, we'll give you the mask. All the training, all the education. I think folks are really getting, we're safe. Come here, get the care you need, and you'll have hopefully a really brilliant outcome and a return to wellness.
Very good. Thank you so much. I have some questions that were submitted to me ahead of time that I will ask, and then we can open it up for a few from the audience. I just am going to say, since I have the mic right now, that I have had a really hard time with the term elective procedures because in my view, if there's a lump someplace and to have that removed, or even just cancer screenings in general, those are not elective by any stretch of the imagination. So I am glad that we are returning to somewhat normalcy and that people feel comfortable going back and having those screenings and those things taken care of, because they're not elective at all. So I just wanted to say that really quick. And we do have some questions. I know I'm gonna try to combine a few if I can. Okay, here's one about the PPE you were talking about. How is Mountain Valley Regional situated on PPE? Do you have enough? And were you ever severely lacking in that any time in the pandemic?
That's a wonderful question. It's a question I get daily, whether I'm standing at a checkout line or I'm with friends socially distancing. That question surfaces all the time. We get it from all community members. And fortunately, I have Dr. Hoang as our Chief of Staff who will jump on in and help support these responses. But what I take great courage in, and I draw a lot of my confidence memory in terms of how we face the community, especially from a PPE perspective, is being part of Tenet. We're one of 65 hospitals, and there's strength in numbers. Being part of Tenet, just in the communities of Orange County and LA, there are 4 hospitals within a 30-minute drive of one another. And so what we do, we draw upon our collective strength in terms of how we face the community and our PPE needs. And so fortunately, throughout this pandemic, which like I shared, our lockdown happened in and around that Friday the 13th through today. We have had no vulnerability around masks or shields or gowns or otherwise. Because if there's a shortage at one of our facilities, You know, we make a phone call, we support one another, and we get a delivery. If any one of our 4 local facilities has a shortage, we have the backing and the strength of our corporate offices in Dallas and the other 61 hospitals as part of the family of 65 hospitals. And there's a delivery. And what's been really remarkable during this whole pandemic has been the county's response. So the county has been stockpiling supplies for many, many years. And we actually are one of the locations in which the county uses to stockpile PPE supplies along with other important medical supplies. And they gave us permission to take down some of those stockpiled supplies when necessary. And while we haven't had to take advantage of that yet, that again gives us confidence that we will be okay, whether it's today, tomorrow, 3 months out, or 12 months out.
Good. And we had some questions just about the rate of patients that you have seen that have become infected with COVID-19. And is there some information that you can give us about, you know, what kind of treatments that you use to help them? Was it the hydrochloroquine combo, the ventilators, anything in or above that, something else maybe? And how, not, you don't have to give us an exact number, of course, but did you see a surge of patients? Were you ever at capacity or worried about running out of ICU beds or anything like that? If you could just paint a picture in that realm for us.
Sure, and I'm gonna say a few words and then hand it over to our Chief of Staff, Dr. Hoang. In terms of context, there's been 7,600 cases in the County of Orange. On any given day, there's between 200 and 300 bedded COVID patients. Most folks are staying at home, quarantining as they're awaiting their medical treatment and just waiting for whatever is making them feel bad to cure. So most patients are at home versus in the hospital setting. Of those, 7,600 patients, we've gotten our fair share. And the numbers are published each and every day on the county's website, and there's access to see of the 30 hospitals that make up this county where those patients have resided. And we've seen, but we get about 10 to 12% of all the patients that have flown through this county and that number of 7,600. In terms of our hitting our ceiling, because we're a large institution, we have 400 beds. We have a lot of capacity around intensive care beds. We've been okay. We haven't been at capacity. We haven't hit that level where we're drawing concern, and we're thankful for that. We've been able to really manage the patient's experience and their care plan in a manner that hasn't put anybody at risk. And we've had some really brilliant outcomes as a result. There's specific questions I'm going to turn over to Dr. Lay, who's been at the bedside each and every day through this pandemic.
Thank you, Ken. Thanks again. I just want to take this opportunity to thank the Fountain Valley Chamber of Commerce to kind of give us this opportunity today. And I'm going to just to piggyback a little bit on Ken had said regarding PPEs. We have a meeting every morning pretty much throughout the entire pandemic, looking at our reserves, looking at what we're doing and what we have. And it's been relatively in terms of, the supplies that we have them. You mentioned ventilators. Ventilators are obviously when someone unfortunately gets sick enough that he or she cannot breathe on his or her own, that we need to put this machine on them. And we still have relatively the abundance, quote unquote. We hope we never have to get to the point that, you hear about ventilators for a couple patients and things like that. I practice pulmonary and critical care, so I can kind of say about this on a personal basis. You mentioned a little bit about treatment. Obviously, unfortunately, there is not really an approved, FDA approved effective treatment for COVID-19 infections. So there's obviously we've heard about one of the antiviral. It's called remdesivir. So that is authorized by the FDA through what we call the emergency use authorization. So the company has quite a lot of medications, and the company provides it to the federal government federal government gives it back to the state, and the state gives it to the county. And again, depending on the amount of patients that we have, the county gives us an allotment once every week or so. So, we actually have a decent amount of remdesivir that we can, provide to patient, and it is an antiviral. So it sort of like acts against the multiplication of the virus when the patient, whoever unfortunately gets the infection. And so that's under what we call emergency use authorization. It's authorized by the FDA. And I'm sure, people have heard about what we call convalescent plasma. These are blood products that the folks who have had the infection and recovered, and they donated to the Red Cross. And, we are able to get the convalescent plasma for patients as well. And again, it is an experimental treatment. Again, there's really no proven treatment. And you also mentioned hydroxychloroquine. I think, just the overall treatment of COVID-19, it's such a evolving situation. Whatever we talk about today can be a completely opposite, or, incorrect by next week, or vice versa. Something 2 weeks ago, we don't do it anymore. So initially, earlier on, we were trying to use hydroxychloroquine with a combination of azithromycin, but based on, the recent data, we're really moving away from it. Right now, we currently do not have any clinical trial, but the recommendation is, consider hydroxychloroquine in hospitalized patients only under a clinical trial. So we technically, by that, we're not using it. Mostly supportive care. Supportive care, we provide the patient, they're low on oxygen, we give them oxygen. If they decompensate further, unfortunately, we have to use the ventilator, but it just give them the support so that the body's fight through the infection. So just to make the short question, kind of long answer there, but anyways, yeah. So I'll stop at that.
Okay, that's good. And let me see. I tried to combine most of those. Let's see. Okay, I'm going to ask one more real quick, just about. Have you seen, like, let's say 6 weeks ago, it seemed that everybody was talking about the numbers were high, we were still kind of on the incline. Have you in the hospital witnessed any sort of plateau or even decline in the number of patients that you're seeing with COVID? And if so, if you can give us a little glimpse into that. And to follow up on that, are you concerned about any reemergence in the fall? Or do you think we're building up our immunity, or what do you think in terms of that?
So I'll start off. I'm all about context, and I'll let Dr. Hoang kind of land the plane, if you will. So I'll take us off, and he'll land the plane. From that Friday the 13th, Friday the 13th, it was a slow drip. We put this massive surge tent in front of the hospital, 3,200 square foot facility with lab capability, pharmacy capability, imaging capability. We were waiting for that big thing, that big storm. The clouds were black. There's a drizzle going on, and we were just waiting. And we took aggressive measures, along with a lot of other hospitals in Orange County. Well, it never happened. It was a slow drip. We never had that New York thing. We never had the Italy thing. We never had the Wuhan thing. And as we have opened up this community, as we have allowed more interactions, as we have allowed people to move about, you're seeing the numbers rise, actually. And that's when you see our numbers go from those low 1,000s to the 7,600 number that presented today as a cumulative total for the county. We're seeing this kind of lift and this almost this plateau. And from our lens, I think it's going to be this long drawn out thing that we're going to kind of hover with these numbers, 100 a day, 150 a day, 200 a day, 80 a day, new cases presenting, all the while others are recovering. And I think it's just going to be this long drawn out thing until, in my opinion, until there's some type of vaccination that is proven successful, or we've moved it through the community in terms of, the herd, as you've heard say, and we're prepared for that. We're very prepared for that from a PPE standpoint. We're educating constantly. We're managing the entrances. We're taking all kinds of precautionary measures, whether it's in the OR, the emergency room, or mom and dad, you know, welcoming baby into the world, and so on. Then I'll turn it over to Dr. Hoang later to add to that.
Yeah, so, you know, Ken also mentioned it pretty much everything. And as you can just monitor the Orange County Public Health webpage. And unfortunately, we still see the amount of hospitalization as well as the ICU beds occupation continues to slowly rise. So, you know, we're seeing that, and you know, until we get an effective vaccination, I think that, you know, we hopefully we don't see that surge that we saw again in New York and Italy. That it's sort of like, you know, stable, so that we're able to take care of all these patients that come in. And you know, with the winter, you know, and then other things gonna pop up. So, but you know, the bottom line, just like Ken said, we're prepared. You know, we obviously see, just like he mentioned, about 10% of what the county sees, and you know, we're comfortable with treating, you know, these patients, and you know, they can be extremely complicated, but I think we're prepared. We know what is expected of us, and I think that, you know, we try to provide the community the best care, and with all the available therapeutic options that are out there for our patients.
Great.
And memory, I think it's worth noting too, memory, whether it's COVID, whether it's the flu, whether it's, you know, years ago, HIV, AIDS, tuberculosis, whatever it is, we have these remarkably trained physicians and remarkably trained nurses and other care professionals. And for those very reasons, we have all these measures out there, all these practices in place to make sure that when our community has a need, and when they come in through that emergency room door, or they need that surgical procedure, they're going to get really brilliant care. And I know other hospitals in the county have a very similar response.
Great, thank you guys. I will open it up. We're running out of time, but I will open it up for a few questions if anybody has one. Okay, Vince, I will unmute you. Go ahead.
Thank you. Well, to either one of you, how do we decipher as the public, because we hear so much from WHO, HWO, CDC, our own county health officials, and it seems everybody's different. And then, you know, if you're online, you hear these other doctors or scientists say something completely different. How do we decipher through all this and know what's right?
I'm going to punt that one to this guy.
That was the question I was going to ask, actually. Yeah, like I mentioned, you know, it's I think it's challenging for anybody, you know, for the public and even for us, you know, healthcare providers to sift through all of the information. You know, truthfully, we still need to follow, again, you know, the WHO, the CDC, and especially the local public health. In terms of guidelines, you know, what to do and what to expect. But in terms of, I can just, you know, speak a little bit more about, you know, treatment options, then we follow all the research that's out there. And, you know, we talk to our colleagues who are in the areas that are affected significantly more. So we learn from them, you know, what works and what doesn't work. But the bottom line, we still need to follow what, again, we follow our local Orange County Public Health guidelines quite closely.
Very good, thank you. Anybody else? Oops, sorry, Vince, there you go.
I'm sorry, she shut me up really quick.
Wasn't from us.
You're mentioning following HWO, but the latest report from HWO was saying that this isn't as bad as it started, as bad as we thought it was. And the masks that we're wearing now actually aren't doing anything for us. It has to be triple layered and you know, filtered that way. So I mean, that's here, you know, what do we do?
You know, I think it's a great question. Things have changed. You know, I totally agree with you. You know, the WHO, even our CDC, you know, earlier on, the WHO and the CDC had sort of like different views on what we should wear. But I think, you know, for the general public, I think that once you're in public, again, you know, try to stay socially or physically distant and just cover ourselves. And the thing, you know, again, is not only to protect stuff from getting in. Again, those things are not protecting us completely, but I think whatever we have, we don't want to transmit to others. Because just even Sheriff Barnes mentioned that we have a lot of asymptomatic folks out there. So I think that all of us, if, even in the hospital, sometimes we think like, we got to approach everybody like somebody who may have the condition. So we got to protect them and protect us. So that's the general advice that we give to the public is when you're out in public, again, try to stay socially and physically distant and also have some kind of facial covering because that would, again, protect it both ways.
Okay.
Thank you. Okay, anybody else? I have time for one more and then we are gonna have to call it. I will say, I have one and this is, I'm sorry, it's kind of coming from left field because I just saw it somewhere last night and I can't even cite my source and I'm not even sure if it's true or false or what, but might as well throw it out there. I had seen or heard that one of the health agencies is saying that they have discovered that asymptomatic spread is not as prevalent as they originally thought. Have you heard anything to that regard?
I can tell you, Memory, I haven't, but doesn't mean that it's not out there. I mean, I think, I can definitely, look and then talk to our other, professionals, especially our infectious disease doc. And if we find anything, we'll follow up with you specifically, and then you can transmit it out to the community. Yeah, absolutely.
Okay, thank you. I just think that is really, if that finding is in fact accurate, that's pretty important, especially to the businesses who are looking to get going with their business. And it could be a pretty important finding if that came up. So I want to thank both Dr. Lee and Kenn for joining us today. The Fountain Valley Regional Hospital has always been incredible partners with the Chamber. We thank you for that and for joining us today. And I would like to end the meeting by allowing our sponsor, Tina, to address us real quick, and then we will be done. Thank you, guys.
Thank you.
Tina, you're unmuted. Oh. There. No? What?
I hope it's kind of like our video. I think can you guys see, can you hear me? Yes? No?
Yes.
Okay. Well, I just want to say to you all, thank you. I'm going to age myself. I know Lene is your representative now, and she was so sorry she couldn't be here. But I was the Fountain Valley Chamber rep back in 2000. So it's truly my honor to be here. And it's just for us to say thank you to the Chamber. Having access to good information is so critically important. And creating this opportunity, I think for all of us, especially when we're all in our homes and we're feeling somewhat isolated, and it's so good to get really, really good information. So thank you for that. I think for the sheriff who's not with us now, we have had a long-standing relationship with him, and we are so thankful for all the work that his men and women do to keep our folks safe as we provide all of you with the service that you need. So during this pandemic, we have been razor focused on just making sure that the hospitals have the natural gas they need to run their hospital, that the restaurants have the flame that they need to cook the food that we're all eating, and for all of you who are at home, that you have the hot water that you need so that you can keep your hands clean, you can take that hot shower, and you can cook meals for your family. So again, thank you for this opportunity. Please be safe and continue doing great work. So that's it.
Thank you so much, Tina. Thank you all. Have a wonderful day. See you next time.